Hello guys, today I'm going to talk about pleural effusion. This is one condition when our lungs, the outer surface of our lungs get filled with fluid. Actually, if I tell you that the covering of the lungs, there are two coverings, and in between these two coverings, the fluid gets filled up. Though normally there will be little fluid for lubrication and for friction and resistant, but then when due to some infections or due to certain other reasons, the fluid collection increases and makes the lung from one side or sometimes from both the sides, I mean to say from both the lungs. If the fluid increases, then it pushes the lung inward, or you can say collapses the lungs to some extent, and then patients will, whosoever is suffering with this problem, will have severe respiratory distress, severe pain, vomiting, nausea, weight loss, loss of appetite. All this sort of problem the person will start facing. And why I'm telling this is because many of us, we get very severe chest pain sometimes, and then we should know how to uh, recognize our problems if we are facing. So this fluid which gets filled up can be due to many reasons. If we have some infections even in our kidneys, in our liver, then also the water can get, or we can call it fluid gets collected, intraperitoneal fluid. The two coverings, you can say, the lungs are covered by two layers, and between of these two layers water gets filled up. One another cause can be tuberculosis. If now we can know that if it is because of tuberculosis, then it will be located in that particular region only where the fluid is collected. Anyway, let me not go into the deep, but the fluid which gets filled up causes lot of problem. Severe chest pain, as I already said, nausea, vomiting, weight loss, no appetite. The person will feel very sick and will be in severe pain. In this condition, we shouldn't waste our time unnecessarily taking painkillers and trying to relax. But then we should go to hospital, and once we reach hospital, get ourselves registered there, and certain investigations will be carried out. X-ray, ultrasound, CT scan, whatever is suitable for the person to get it done. And once they come to know, once it is confirmed that the fluid is filled up, then they will try to, if the person is really in a big distress having respiratory problem, then they insert one needle and they take out some fluid. At the same time, they also send the fluid for investigations. They send it to the lab. And one thing, when fluid gets tested, if the protein level is high, then that means tuberculosis can be, the person may be suffering with tuberculosis to some extent. And then patient will be given Procedure wise, they will put some tube also, which is called intracostal drainage tube, which keeps draining the fluid out, and in between, doctors will maybe with the ICD tube, patients will be going home, and then they will be called as a follow up. Again, ultrasound will be done. If they are relieved of the pain, of the pressure, of the symptoms that they were suffering with, then the doctor will take out the tube and close that area. But immediately they also take out some fluids, as I said earlier, so the person will get relieved of the pain and especially respiratory distress. And getting respiratory distress is a great difficult time that the person goes through. So getting relief of that is the utmost important thing. So today I just told you about what is pleural effusion. Actually, I will summarize it. Pleural effusion is the fluid getting filled up in the space that the lungs are covered with two layers, and in between there is a little fluid which is normal, but when they due to some infections or tuberculosis, or the fluid increases in volume and pressurizes the lungs to go inside or become small, and then the respiratory problem develops, pain develops, and all sort of symptoms which I said. So to get relief of that, you need to go to hospital, get yourself investigated and treated, and get yourself relieved of that. Thank you very much.